Today we're going to go over fundal massage and how to assess the patient's lochia. When assessing your patient's fundus, you're going to have one hand on the lower symphysis pubis and your other hand midline at the umbilicus, which is the tip of the belly button, and you're going to go ahead and use a gentle circular motion to determine where the uterus lies. Sometimes you have to be quite firm depending on the body type. I'm going to go ahead and lift my patient's underwear up and currently check the amount of lochia. Is it scant, light, moderate, or heavy? And I like to check the bleeding while I'm also massaging. I'm going to do one final massage, cup the uterus to determine that it is firm. So when assessing your postpartum patient after they deliver, usually in labor and delivery, they are in recovery for about 2 to 3 hours, depending the type of delivery. And the first hour after delivery, they are assessed with their fundus and their lochia every 15 minutes for the first hour, and then every 30 minutes for the second and third hour. And we're basically just making sure that the uterus stays firm, it's not boggy, and then of course we're assessing the lochia. Okay, so there is 3 types of lochia, but the one that you guys are going to see in the hospital is lochia rubra. You also have lochia serosa, which happens anywhere from 5 to 7 days after the delivery, and then lochia alba can be anywhere from 7 to 14 days and could last anywhere from 4 to 6 weeks depending on your patient. Okay, so whenever you are assessing your lochia, we have light, moderate, and heavy. Okay, light is what we want to see. When we are assessing that every 15 minutes, the first hour, you might see the moderate, and then we're just, of course, observing very frequently to prevent postpartum hemorrhage. Okay. Whenever they move to the postpartum unit within 2 to 3 hours, that initial nurse is going to do the fundal and lochia assessment, and then they're going to determine how often the patient will need to be assessed from there. Okay. If you do have a patient, whenever you are assessing, that's pretty moderate and consistent, they're not saturating the pad in an hour, but it's pretty filled up. We do want to make sure we're monitoring them maybe every 30 minutes to an hour post-delivery from postpartum. But if you are seeing this type of bleeding in postpartum after 3 hours and they are saturating the full pad in an hour, we do need to continuously do fundal assessments. We need to clean the patient, give them fresh pads, and reassess continuously, and letting the provider know that their bleeding is heavy so that they can go ahead and intervene.